Good evening, and thank you for taking the time to review this presentation of the community analysis of St. Pete Beach community. The objectives which will be covered are the historical overview of the St. Pete Beach community, a community analysis consisting of environmental analysis, health-related resources, Healthy People 2020, and government and public policy analysis. Also, we are going to cover prioritized community problems and a global community issue. The St. Pete Beach community was first settled by the Timucua Indians around 300 AD. This community has transformed from hard-to-access area, initially reached by ferries or other water transportation, to a bustling tourist community whose major source of income is based on tourism. In 1928, the Don Cesar Hotel was established. The completion of the Quarry Causeway in the 1930s brought the island community more residents and businesses. In 1957, the four communities of Pass-a-Grille, Don Cesar Place, Bella Vista Beach, and unincorporated Pinellas came together and created the city of St. Petersburg Beach. In 1962, the Pinellas Bayway was also opened up, adding another bridge access towards the southern end of the community. In 1994, the community voted to further distinguish themselves and agreed to change the name to St. Pete Beach. As the community continues to age, there has become a constant battle for the community, land restoration versus further development. This slide shows key highlights of the current state of the community. The shoreline of the Gulf beaches along the fine white sands are what draws crowds to the area every summer. The Don Cesar Hotel on the right-hand side has become a registered historic Lowe's hotel. Built in 1928, it has transformed from a hotel to a government hospital to a Veterans Administrative Center, all before a multi-million-dollar restoration in the 1970s, transforming it back to the hotel it is today. The city of St. Pete Beach is 2.13 square miles with a population of 9,496, a population density of 4,389 people per square mile, and its major attractors for tourism are the warm climate and also the Gulf beaches. The St. Pete Beach community borders the city of Pasadena just north of the Quarry Causeway. The Pinellas Bayway Bridge at the south end of the community connects the Bella Vista area with the South St. Pete. The population becomes probably an increase in 15,000 people during the winter months due to the tropical climate of the community, which brings the snowbirds, if you will, down from the colder areas. With the population issues, one of the possible health needs of this mixed population would be accessibility to health care. For the elderly, they may need more assistance in getting to their appointments and keeping track of routine health screenings. On the other hand, those visiting from out of the community may not know where their local health resources are. For this matter, it is imperative for the local hospital and healthcare centers to distribute information throughout the high traffic areas within the community. St. Pete Beach has a few elementary schools located within the city limits. One of them is going to be Gulf Beaches Elementary School. They also have St. John Vianney Catholic School, St. Pete Beach Community Child Care Center, St. Albans Episcopal, and there are no colleges within the community limits, but Eckerd College and both St. Petersburg College are probably about less than 5 miles from the city limits. St. Pete Beach Public Library is open to the community Monday through Saturday. Monday through Friday they're open 10 a.m. till the evening hours, and Saturday open 10 a.m. to 2 p.m. Some of the services provided at the library are basic computer classes, book reservations, a used bookstore, children's story times, adult discussion groups, and local author forums, to name a few. Some of the types of materials offered are books, magazines, DVDs, audiobooks, CDs, online databases, ebooks, and music. The community also has its own post office and full-service shopping complexes. Within the city limits are major grocery stores, major banks, gas stations, a vet clinic, fast food, realtors to assist with rentals and home buying, and a multitude of restaurants and bars. There are resources abound in a small community, and therefore most of one's needs are just about within walking distance. The most numerous housing type within the St. Pete Beach community is a vacation condo type. Along the intercoastal waterways, you can find extravagant houses as well as beach-type cottages throughout the community. There are 7,854 housing units. The fact that there is a 68.5% homeownership can be related to the fact that there is about a 15,000 drop in the population once the snowbirds go back to their homes after the winter has passed. There are no homeless shelters within the area, although there is a drug and wellness rehab program named Transformations by the Gulf located within the community. The median household income in this community is roughly $61,000. 15% of the community earns upper middle income and above as compared to the state of Florida at 10.6%. The percentage of the population earning less than the poverty level is 4.6%, significantly less than the state at 11.9%. 51% of the community is employed, comparable to the state at 52%, and less than 5% of the community is unemployed. 32.5% of the population is 65 years or older. From these aforementioned statistics, it can be deduced that a majority of the city of St. Pete Beach is comprised of wealthy retired population, as well as a high-income residents, allowing for the luxurious waterfront homes. The top 6 health issues of the community are cancer, heart disease, chronic lower respiratory disease, unintentional injuries, stroke, and Alzheimer's. According to 2011 statistics, these are some of the leading causes of death within the community based on the Pinellas County Health Assessment, listed in order of occurrence. These leading causes of death apply to the St. Pete Beach community, particularly due to the population of the elderly. As the population ages, they are more likely to develop one or more of the mentioned disease processes. The sun alone along the beach has a community at an increased risk of skin cancer if the beachgoers do not take appropriate measures to protect themselves. Unintentional injuries such as falls, domestic abuse, car accidents are associated by functional limitations of an individual, whether it be due to comorbidities or substance abuse such as excessive alcohol intake at the numerous bars along Gulf Boulevard. The main artery road through the St. Pete Beach community is Gulf Boulevard. As earlier mentioned, a majority of the storefronts, bars, hotels, and other areas of interest are located along Gulf Boulevard, having a majority of them within walking distance. For those who prefer not to or are unable to walk or drive, there is a beach trolley available. The Suncoast Beach Trolley allows for greater access and exploration of the community. The beach trolley runs along Gulf Boulevard and also has connector routes to downtown St. Pete. For those who wish to stay within the community and enjoy the outdoors, there are 9 community parks available, most with shelters, grills, and playgrounds. A few with exercise courses as well. These exercise courses are located within the community, are a great way to encourage health promotion within the community in order to reduce the amount of functional limitations in the elderly. The attraction of the beaches provide most of the tourism for the community. With tourism comes income to the city. Some of the other areas of interest to the residential population and tourists are the St. Pete Beach Rec Center, St. Pete Beach Aquatic Center, and the almost innumerable bars and restaurants along the Gulf Boulevard Strip. The City of St. Pete Beach is governed by a City Commission. The St. Pete Beach City Commission is comprised of a mayor, vice mayor, and 3 commissioners. The commission meets on the 2nd and 4th Tuesday of the month. Meetings are open to the public. Meetings have been archived online since 2008. The community is able to watch the video of the entire meeting, and the agenda and minutes are provided as well. Agendas and minutes are available the Wednesday prior to the following Tuesday's meeting. All commissioners and the mayor and vice mayor are available to the community by phone and by email as listed on the city website. The County Commission approves the budget every year pertaining to the priority needs of the community. Pictured above are the commissioners and their respective districts. The community of St. Pete Beach was patrolled by the St. Pete Beach Police Department for over 50 years. Due to budgeting, January 8th of 2013, they had their final call at the department, and the jurisdiction was turned over to the Pinellas County Sheriff's Department. There are 2 fire stations which are located within the St. Pete Beach community, Station 23 and Station 22. Station 22 is located in Pass Grill, whereas Station 23 is located along Gulf Boulevard, close to Corey Avenue. Station 23 is also where their administrative building is located. The Public Works or Public Services Department covers environmental programs, parks, water services, including wastewater, stormwater, and reclaimed water, sewer and solid waste management. They also cover maintenance, design, and planning of bridges, roads, sidewalks, and traffic light placements. One of the bigger issues is that the Public Services Department faces in the community is signage and parking developments. With the high volume and high traffic along Gulf Boulevard during the warmer summer months, the pedestrian crosswalk signs are key in public safety and prevention. Parking has historically been an issue as well. For such a densely populated community, development of additional parking needs to be an increase in priority. Palms of Pasadena Hospital is a full-service hospital local to the community. It is not within the city limits, but less than 1 mile from St. Pete Beach City Hall, just north of the Quarry Causeway. The local health department is available in the Pinellas County Health Department, located in downtown St. Petersburg. There is one convenient or urgent care clinic in the community, Bayfront Convenient Care Clinic. At the urgent care clinic, one can receive minor health care issues from a qualified medical professional without incurring additional fees of an emergency room visit. This is helpful for those visiting so they do not have to spend vacation funds on the cost of simple health assessments and/or care. That being said, the urgent care clinics have a limit on services available outpatient. For example, stingray injuries are referred to the local hospital for treatment, and yet flu shots can be administered at the local Walgreens. Palms of Pasadena Home Health Care offers 24/7 home health care coverage, providing multidisciplinary therapies. Usually the home health care will be arranged by one's primary care provider and a case manager. Within the St. Pete Beach community, healthcare is quite accessible, not to mention the fire departments and also Sunstar Paramedics Company, which responds in an emergency situation, will transport anybody to the local emergency department. Within Pinellas County, EMS transport to hospital is on average a less than 15 minutes non-emergency. Using Healthy People 2020, 3 specific community objectives are C1, the overall reduction of cancer, OA5, reduction of elder population with functional limitations, and AHS3, increase the proportion of persons with a usual primary care provider. The first objective was chosen based on the overall leading cause of death, as according to the Pinellas County Health Assessment. The second objective was chosen due to the percentage of the population of the community over the age of 65. We want to keep the population high functioning and promote health wellness in order to prevent unintentional injury or disability. The third objective was chosen due to the fact that the tourist population of the community does not have a local healthcare provider, and therefore they visit the local ER frequently. All across the world, access to healthcare is a priority issue which needs to be better developed. One of the ways to increase access would be to encourage mobile healthcare units, not only for those in poverty, but for any at-risk population. According to Dr. Mansfield, as the population continues to age, there is a greater need to be able to provide limited healthcare within the home. Another way to possibly increase access to healthcare is technology. With patients able to access their health records online and also communicate with the healthcare providers online, this could possibly lead to patients taking charge of their healthcare and making sure they are following through with their chronic condition regimens. A lot of the time, a communication barrier alone is a reason why one may not be able to manage their healthcare conditions to the best of their ability. One of the ways in which Palms of Pasadena Hospital is dealing with this in the community is by distributing healthcare information throughout. The hospital also performs annual health fairs and screenings. A public health nurse could intervene with this situation by training the population with established healthcare. Those who have the healthcare, those who may not, and the disparities which may arise. From this assessment of the community, the public health nurse can help develop and implement a program in which to promote access to healthcare, whether it be opening a physician's healthcare clinic at a local homeless shelter, or enrolling doctors to be primary healthcare providers of those who come to visit for months at a time. Maybe there could be a case manager involved who could facilitate obtaining, sorting health records from the patient's primary residence in order to be able to better manage chronic conditions as well as the acute away from home. Again, thank you for taking the time to review this community analysis presentation on the St. Pete Beach community.